Hi, everyone. We're going to start a segment called Quarterly Questions, consisting of the most frequently asked questions from patients online that we receive. Let's start with the first question. Dr. Payman, what is the actual difference between an upper eyelid lift and a lower eyelid surgery? So to answer this question, we need to understand how patients present with upper eyelid hooded skin, usually, that drapes over the upper lid platform, or a condition called ptosis where the lid is actually lower down than normal. Depending on which of these two conditions a patient presents with, we may need to do either a blepharoplasty designed to remove the upper lid skin that's draped over the eyelid, or we may need to do a muscle advancement type surgery designed to lift that lid platform higher. Sometimes patients may need both at the same time. It really depends on a patient presentation. So there's a couple things to consider when looking at the upper lids. This differs from a lower eyelid surgery designed mainly to reduce the pockets of fat under the eye that sometimes can manifest in patients and become more obvious over time. And depending on the presentation, this may entail just focusing on the fat pads themselves. It's less of a skin reduction, it's more of a fat reduction and or repositioning. Sometimes a patient may have some redundancy under the eyes, festoons, or just lots of laxity in the skin, for which we would then think about doing a skin pinch, sometimes a tightening of the lower lid skin, or even a tightening of the lower eyelid that can be used to basically support the lower eyelid position, bringing it up closer against the eye and looking tighter as well. Additionally, we sometimes think about laser skin resurfacing under the eye in cases where there's some laxity of the skin that doesn't necessarily need a skin pinch, just a little laser skin resurfacing. And that can make a very nice difference in conjunction with the lower eyelid blepharoplasty.